So I go to fire it, and it's kind of like I'm turning the key and it's just not starting, right? So I just can't get enough fuel there for the amount of work I'm trying to do. And people know this feeling because it's that feeling of fogginess, or like my memory is just, I can't get it. Or like I'm working through a problem and I can just feel my battery draining as I'm trying to think.
Welcome back to the podcast. Today, special guest, Dr. Nate Keiser in Chelsea, Michigan. Welcome this morning. Appreciate you.
Yeah, I'm really happy to be here talking with you again.
So we're getting in today to something that affects millions of people worldwide, and it is really related to something called dysautonomia. It's where part of their automatic nervous system, we could say, affects things in the body because it goes awry, and many things can cause that. We'll kind of dive into that with Dr. Keiser. But as we're getting with him, I want you to know a little bit about him that I've known. He's been an instructor worldwide and in the US teaching people in functional neurology. And I like having people that are in this area, that I practice in, because it really brings a fresh light to what's going on in the brain. And what I mean by that is that we're looking at things from a different angle, a different bias, and many times that'll just open up the world for many of our patients that we see, or people that have kind of lost hope. So as we get into this with Dr. Keiser, realize that he is someone who is sought after in Chelsea, Michigan, is where his center is, Keiser Center there, and works with patients from all over the world and helps them to restore and regain brain health, which then, of course, affects their body in a dramatic way, really giving people back their life. That's something that, in just a synopsis, that's what I like to do. Let me give them back their life, what they wanted to do, and I know that's what he is passionate about. Dr. Keiser, tell us a little bit about your upbringing, where you kind of started. I know you're a Midwestern guy, so tell us a little bit about that.
Yeah, thanks. Yeah, so I mean, I lived just a normal, like middle class Midwestern life growing up, which is, from my perspective, a wonderful way to grow up. And, just got to be able to do everything, got to play sports, got to go to a good school. And that really kind of set up like the cascade of things that would come for me. So I was an athlete and loved being in the gym. Still love being in the gym.
Mm-hmm.
Learned I was like pretty young when I would go to the gym, and then I had like coaches and people that were just in the gym working out with us, and they would be like, "Hey, will you write me up a workout program?" And I was like 14, 15 years old, just like thrilled to
Wow.
do that. And I would I would write it up, and we do 6 weeks, and then we'll do more, and then we'll test it and all these things. And I just loved that. I wasn't smart enough to monetize it or anything like that, but I just loved it. Fast forward, when it was time to start picking a career, I didn't really know what I wanted to do. I was good at numbers, good at economics, but I didn't love it. But I really liked the idea of like helping people be healthy. And I didn't know what that meant. So my first like path, actually, that took me all the way through to my senior year in college, was to do prosthetics and orthotics. I started college right around the time the towers fell. So like there was like an obvious military component of that for me, where I had friends that were, coming back, and, people were losing limbs and things like that. So that was kind of where I was thinking. And then I had a friend that got sick, and she'd had this chronic health condition since the time she was young. And it just kind of ebbed and flowed with these problems that they just, for lack of a better word, nobody could figure out. And she kind of was like, cast to the side. It's in your head, these sorts of things. And like spending time with her, I knew that that wasn't true. So I was digging around trying to figure out what was going on. And this is like early 2000s. I don't know if you remember what the internet was like back then, but it is not as robust as it is now. I was just hunting around. Like, you couldn't really find, like, they didn't have YouTube and videos everywhere. It was like, I sent away for a VHS cassette of this doctor named Dr. Carrick. And it had these 3 case vignettes on it. And they were just these cases, like crazy stuff, right? But things that, it was the same thing where people just couldn't figure it out. And then he just kind of comes in and is like, "You're all better." And I was just hooked on that from the beginning. I was like, what is this guy doing? We got to be able to help people like this. And it was, and from there, like, it's had its hooks in me ever since then. And so I went to chiropractic school because he was a chiropractor by training. I was like, I'll do that. And I'd never been to a chiropractor, didn't know anything about it. Got to school and was like, I don't really get some of the stuff that's going on here, but I just wanted to know everything I could about the brain. And I think I'm still in a lot of ways doing that.
Yeah, I love that. That's such a wonderful thing. And it's true. Dr. Carrick has, I mean, of course, yeah, his background is actually very diverse, right? Before even
Oh, man.
chiropractic, but that was just a pathway. I mean, he's been worked with Harvard and Cambridge and Oxford and people from all over the world, all types of research related to the nervous system, the brain, health overall, even mental health, many.
Mhm.
I know with gentlemen over in the UK and had dramatic breakthroughs now working with stroke. And I follow all the articles that are coming out and related to stroke recovery. So he's an exciting individual, very forward of his time. And I would say he's right on the level with many of those French neurologists that we love to think about and understand and help people get back. So he's been a great mentor to you. And then, of course, he's been a mentor to me to a degree. And I've always appreciated him. So shout out for Dr. Carrick and all that he's
Always.
done.
Yeah,
Always
absolutely.
deserves a hand clap for sure. But moving on, I should say, and moving on to you now. Now you're in this field and you're working, and then you, in your own pathway, have some health challenges. I feel, I mean, correct me if that's not it, that lead you into this world of autonomic function of the nervous system and the way the heart and so forth function in the body. Can you touch on that a bit?
Yeah, that's definitely part of my story. And there's an irony to my story because so I actually started down the road of autonomics when I worked in clinic with Dr. Carrick, as you know. And in that process, we were seeing a lot of people with mild traumatic brain injury, concussion, kind of in the wake of the news getting out that he helped Sidney Crosby get back on the ice, famous pro hockey player. And then from there, it's just like a deluge of people with the same types of problems. But we were noticing that there was this subset of people that had concussions and traumatic brain injuries that also had these severe autonomic problems, and just to the point where they're not able to effectively circulate blood to their brain, and it would
Mm,
cause these accelerations in their heart rate, right? So we would see these high heart rate folks, foggy, blurry vision, these sorts of things, and they took a different amount of effort than people that had a different set of symptoms. So we could start to peel apart that like there's something else going on here, and got that was like something I couldn't get out of my brain. It was a worm that was in my
mm.
brain. And then so I started really diving into that on my own and through work with Dr. Carrick, and started to get a sense of that, like, oh, we can look at this differently than people do now, and it will be useful. We can look at it rather than looking at it as a cardiac problem or looking at it as like a peripheral vasculature problem. This is actually like there's this big subset of people. This is actually in their brain. And to get back to your point of my health, so I started down this road super hard and then ended up with my own foray into atrial fibrillation when I was in my early 30s, which was just this wild paradox, I guess, or irony, because here I was like kind of taking off into a field of like into a frontier of things that other people weren't doing, and then now I have my own autonomic problem. And so I got to
Right.
experience all of the things that the people that I was treating, I got to experience that too. Not my favorite thing I've ever done, but it was instructive. And for me, it was also humbling because the particular problem that I had was in actually the structure of my heart. So I ended up lobbying and finally like fighting to get a surgery, which if you know me is just a strange idea.
Yeah.
So ended up having some resolution from that. But and luckily, fast forward, things are going great for me now. But it gave me this like Alice in Wonderland moment of like, oh,
Mm.
I like thoroughly understand what people are going through, and it just was a thing that gave me another gear to be able to push forward. And since then, we've taken that and have really expanded our diagnostic criteria and doing things that are unique, let's say, and being able to hunt
Hmm.
down problems that I would say are outside of the bell curve of what most people are experiencing kind of in a more conventional path. I think I'm saying that with a little bit of like I'm hedging a little bit, but that's kind of where we are now.
No, I like that a lot. I like that you're hunting down areas because this is, I talk about health mysteries and health detectives, and you have to hunt down clues that may have been overlooked. I love the way you phrase that. Of course, I'm not a hunter. We've talked about the hunting up there, the deer hunting, and how beautiful that is for you all. So I really like that analogy, though, and then using the technology to hunt those things down and then understanding what it is rather than, well, maybe versus what is commonly, we get people with tilt table tests as an example, and they're like, oh, everything's clear. I'm like, okay, let me look at the details of this first, and being able to hunt through those details and pick out like, well, it's got some things in here that help give me ideas where we need to go deeper. Yeah, I really like the way you phrase that. So when we talk about, I like the way you opened up by saying blood flow. People are having this subset of people with these traumatic brain injuries, concussions, are having problems getting blood flow to their head, and then therefore the resultant effects on their heart rate and so forth, or other physiology. Talk about if you would, I know you mentioned three primary mechanisms, if you will, and of course our listeners are at different levels, but three primary mechanisms that you've actually educated me and many of our doctors with in terms of how that autonomic system regulates itself.
Yeah, for sure. So just thinking on a neurological level, like that's kind of the high level framework. You're really looking at a coordination of being able to coordinate the electrical activity, like coordinating the computer that controls the plumbing. But the hard part is the plumbing is what feeds the computer. So they have to work in this balance. So we can have different ways in which those two systems kind of become uncoordinated or fall out of sync. In first one we think about is like neurovascular coupling, fancy word for when I go to fire my brain, I don't get the same amount of blood flow that should match that to be able to fuel it and keep it going. So I go to fire it and it's kind of like I'm turning the key and it's just not starting, right? So I just can't get enough fuel there for the amount of work I'm trying to do. And people know this feeling because it's that feeling of fogginess or like my memory is just, I can't get it. Or like I'm working through a problem and I can just feel my battery draining as I'm trying to think more in conversation. You just feel that like that film come over your mind. So people have experienced that before, whether they know what it is or not. And then, so with that come these different reflexes that are in the brain. And one is autoregulation, which is where your brain is able to control the blood pressure within your skull differently than the blood pressure within your body because you have different
Right.
constraints inside of a hard skull. So that's one. And another is like vasoreactivity, which is how it's like how your brain samples the chemistry of your blood. How much acid, how much CO2 is actually in that blood? Because when I'm using my brain, it produces CO2. So your vessels are constantly measuring like how much CO2 is here. If there's more, I'll send more blood. If there's less, I'll shift it somewhere else. But all of these things kind of become uncoupled, they get desynchronized. So when you go to
Yes.
try to do these things, you can have injuries wherever that may be, or we'll talk about different ways that happens. But then you can see them decouple in real time and go, oh, if we're going to solve this, yes, we have to make that part of the brain stronger, but part of that solution is going to be I have to do it in a way that I'm not overstimulating them so that they can't heal. So we can actually make it worse. And that epiphany was kind of the first big one that I started sharing with people to try to say like, well, yes, we want to stimulate it, but also we have to stimulate it in a way where we actually fix these reflexes first. And if we do it
Yes.
in that order and back that out, then it's way easier and people can get some momentum and some traction and get going.
Wow. So many great pieces in that. I love the computer and the plumbing, right? And the integration, the coupling of those two systems. That is brilliant. And then these three processes that the brain uses to make sure it's getting fuel so that it can carry on its work and carry on its function. And so let's talk for just a moment. So we have to use very unique diagnostic evaluations for people, and people will, I'm sure, ask you in your center, and they call and ask us all the time, well, how do you analyze my brain? Are you going to do a CAT scan? Are you going to do an MRI? What are you going to do to measure my brain function and find out where these imbalances may be? How can you kind of cover that a little bit for people?
Yeah, I think what you're touching on there is a really good question because most of the way we think about things are kind of like through our eyes. Like, can we see it? So the hard part is it's hard to see. So we have to find a
Yes.
way to be able to kind of take it for a test drive. So I think about it as like a mechanic. I very much picture myself as like a backwoods auto mechanic. And I want to get in the car and drive it and feel what's wrong. And when I mean that by that is like, I want to see the way that people operate. I want to see reflexes work the way they should. When you try to do something a little more complicated, does it work the way it should? A little more complicated, does it work the way it should? And
Hmm.
there are these simple things that we've been doing for hundreds of years that allow us to be able to look at if things are working correctly or not. And by sampling that, you can triangulate and say like this is not working. And then also we have some more advanced diagnostic tools that we use like Doppler and duplex ultrasounds that help us look and visualize the blood flow and measure the blood flow. We look at neurological function so we can see if it's working right. And then you're just taking those two things and overlapping them and then stepping back and going, okay, how is all this interfacing? It's almost like people arrive with having so many hands in the process. So I think about it almost like a desk that's just full of papers everywhere, trying to describe what's going on. And we just kind of clear them all off and we start from the beginning and just look at the layers of that. And I have a conversation with every new patient around like, we're not going to assume that we know anything at this point. Like, as I meet you, we don't know. Like, you've been diagnosed with whatever, POTS, call it. Fine. Maybe, maybe not. We get rid of it all. And then I'll develop a sense of, and I think you probably do this too, you develop a sense of what you think it is. And then once you get that, you kind of like write it down on the tablet of your mind. And then my job now is to try to prove that that's not true. And
Hmm.
if I can prove that's not true, then that keeps me hunting for the problem. But if I can't prove it's not true, then now we've identified our problem and we've excluded all the others. And I
Got it.
find that conversation with people, and I'm talking about them like it could be this, it could be this, but okay, I'm seeing this. That makes me think that that's not happening. So let's kind
Right.
of move that over to the side. And as we're doing that, we can start to work together and be a team and be able to work through the problem so that like I know people aren't seeing what I'm seeing just because we have a different training, but they're able to walk with me on the process of how are we getting there, and then we can see to what degree that makes sense to both sides. So I
Yeah.
like to like say let's do it together and let's try to prove me wrong, and if we can't, then we'll have arrived.
Yeah, that's great. It's working like that null hypothesis. Let's try to prove this is
Exactly.
not it, and then we end up with whatever's left. Then that's the highest probability, and let's work on that together. I love the collaboration that we can engage in with a patient. These are, I mean, I've always seen that in 35 years. The people that get the best results are the ones that step into it with me,
For sure.
right?
I absolutely agree with
Yeah.
that.
When they take agency, my wife and I talk about that. When they take agency, when you can take agency, and I know it's hard for some people, but
Mm-hmm.
whatever level it is, you can take agency and start to just put your participation in and work hand in hand with the doctor. That is dramatic, dramatic. So we talked about the different aspects of that quickly and your entrance and then the technologies and how we use our eyes. We want to see things, but we have to look at the functionality of things. There's functional neurology is tied up in that, is really looking at taking the brain for a test drive and the body so much. The other thing I think is interesting for people is to understand. Oh, I lost my train of thought. This is the way it really is, right? You have so many wonderful things in your mind. I was going, oh yeah, I'm back. Okay, good. So I was going to say there are different things that can cause, besides a traumatic brain injury or concussion, can drive this dysautonomic, this decoupling in the brain and the computer and the plumbing system, so to speak. So the vascular system. So mention a few of those that you've come across recently. You know, some of them more recent. I think that's a help.
Yeah, I think that's a good place to start. So, just some things to put ideas out there for people, especially for people that are stuck, right? So, if you're kind of trying to figure this out, I think this might be helpful. So, we can have problems that are internal to the brain, and we kind of talked about a couple of those just within like the structure of blood flow. But then also another kind of key neurological part is, do I understand where my head is like a gross way of thinking about it. So it's like a cortical schema technically is what how you think of it. But what it means is like where's my head? So you'll see people that kind of walk around with their head in different positions, or their balance is a little off, or maybe they don't see very clearly, and as a consequence, their actual representation of where their head is in space may not be true to where it actually is. And a lot of the reflexes around blood flow are, I mean, everything is designed to push blood up to your head, which is kind of hard
Mm.
because you're pushing against gravity and it has to be precise. So when that gets uncoordinated, so if I have graviceptive problems, problems with my inner ear, problems with the way that information processes, we talk about, the inner ear, your visual system, your somatosensory system. When all those things become kind of desynchronized, then we start to lose the sense of where our head is. And then the secondary component is we won't be so good at sending blood flow to it on time to the right place. And we see that not just with problems with your inner ear, but also maybe problems with your neck. So many
Yeah.
people with what are actually whiplash injuries to their neck have a high correlation with autonomic problems. And we also see that decoupling or uncoordination of your neck. So if your neck's stiff, even though it feels like you get to the right spot, your body may choose a whole different way to get there, kind of uncoordinated and a little bit, off. And you feel that because it feels stiff and crunchy or whatever that is. But we also see that when it does that, we can impede some of the vasculature and some of the neurology that just travels through your neck. So if my neck moves interestingly, the vertebrae can actually become an encumbrance. They can actually impede the flow of blood going up to your head or blood draining out of your head. They can impede, firing of the vagus nerve, if you want to get into that. They can start to cause problems inside the spinal cord where we get compression of the spinal cord and it starts to mess with causing palpitations in your heart, changes the way like your bowels and your bladder work. So I think that a lot of people sleep on that one where we really have to kind of know what's going on in this neck, which is kind of like the roundabout blessing of being a chiropractor that I didn't know was going to happen was that we actually just had
Yeah.
stuffed away like a knowledge base about that neck. But we see it with ultrasounds where, they're fine like this, they're fine laying down. So you go into your normal imaging center and, they put you like this for your ultrasound and you're like, it's great. But then we sit you up and you turn your head and it's like that vessel closes right down and they're like, oh, I'm getting dizzy. You're like, yeah, there we go. So all those things become like just different ways to think about autonomics. And then I know I'm rambling, but then we can also go into peripheral nerves and the ability to be able to shunt blood back to your heart. And then you kind of walk down through all this land of blood flow.
It's very good. Very good. I like the component that you just mentioned about where is your head? Where is your head in space? So head and neck position play a huge role potentially in the way the brain is going to help regulate that blood flow because of the feedback loops that are involved in there and feed forward things that are working both directions, right? This is a great simple statement. Where is your head in space? How is your neck? Because we see people and it's common. I mean, our listeners will say, yeah, look at your family, look at your husband, look at your wife, look at friends, look at people in church, look at people at the movies and in the shopping center. Are they carrying their head tilted to one side or are they shifted forward? Take a look at those things and realize that not everyone has an autonomic problem, but those things can be probable relationships to there. That's a great simple statement for people. That's an important component. I think where I was going, but I like the way you went actually, where I was going was other things besides a physical impact. And I think maybe we'll probably leave this because I want to kind of put a bow on this for today or put a pin in it, whichever one. Tie a bow on it, put a pin in it.
Let's put them all in there. We'll keep it real tight.
Yeah, that's right. Is maybe the next time is talk about other things that might affect directly the brainstem, which is a pretty big autonomic hub, if we could say it that way, and or the center of that, and the different conditions from immunologic to other types of things. I think that would be a good show on its own because you and I know we've seen a lot of that as well that complicate the autonomics. What do you think about that? Yeah?
Yeah, I think that's a great topic. We can definitely dive into that one. You're saying let's do that
Okay.
in the future.
Yeah, let's do that in the future. I think that's good. I mean, one of the simple names is talking about what's known as long COVID or immunologic injury to that brainstem, things that might happen like that over time, and then how that, because also we know there's the physical, right? There's the concussive forces, there's the spinal cord effects and the cortical effects. So I think going into that one, because it's been such a big component as of recent, yeah, we'll dive into that and we'll call it, the brain and long COVID, I guess, whatever.
Let's do that. Yeah, I love it.
Yeah, that
I
would be
love it.
good. Well, listen, I appreciate your time today. We kind of like entered into this. This will be part one. We'll do a part two with Dr. Keiser and we'll get into this. If you want to get in touch with him, you get into Chelsea, Michigan. Tell us the name of your center, Doc.
It's the Keiser Clinic. So we have it used to be just me, and then now we've got a wonderful team of doctors here, and yeah, so it's a great time. Thanks for
Yeah,
having us out.
great place to be if you need to recover your health. So we appreciate Dr. Keiser. All right, Doc, appreciate you. Thanks for coming to the podcast. We'll do part two.
Thank you.